Dan Bensimhon, Mike Gibson coming to you live from AHA 2024, and we're talking about probably one of the biggest PK/PD studies in diuretic or loop diuretic history, comparing nasal spray, bumetanide, versus oral and IV. So talk to us about this, Dan. It sounds interesting.
Yeah, Michael, as you know, with heart failure patients, one of the big things we worry about with heart failure patients is diuretic resistance. That patients, when they have a heart failure flare, when they need their diuretic the most, that's often limited by gut absorption and oral absorption of their medicine. So they're forced to get admitted to the hospital for IV diuretics. So the idea here is there are other ways to deliver loop diuretics to get into the system effectively without having to rely on the gut. And there's been other products now in the market that's shown really effective studies with subcutaneous delivery of these diuretics. And in this study, we looked at a novel development of an intranasal form of Bumex or bumetanide, and we did a very large PK/PD study in 68 patients to compare oral, IV, and intranasal doses of the medication.
How did you do that? Did you lock them up for a few days in a unit?
Yeah, so it was 68 subjects. Each patient so it was about seven groups between 10 and 15 patients, or healthy subjects. They were cohorts of 10 to 15 patients. They were admitted to a research facility, and they were randomized to a pattern of five different diuretic dosing. So they got one dose of IV, a 2-day break, one dose of oral, 2-day break, and so on. So they got two doses of oral, two doses of intranasal, and one dose of IV. And then very, very rigorous PK and PD monitoring, 23 blood samples over the course
Mm.
of that period, looking at just serum electrolytes, urine electrolytes, and really monitoring what the concentrations were doing, and then what the urine output was.
Now, Dan, these were healthy volunteers, so they didn't really have gut edema.
Right,
Is that?
exactly. So this is just an initial PK/PD study looking at in healthy volunteers. This is a new formulation.
Hmm.
Intranasal is a new formulation and a new delivery system. So we're really just saying, one, is this safe? Is
Hmm.
it tolerable? And can we deliver it well to the subjects?
And what did you find?
Yeah, the results are really interesting. Obviously, with the IV, you get a higher concentration initially, but if you look at the area under the curves for these medicines, you see IV is a little bit higher, but very similar areas under the curve for intranasal versus oral medicines in healthy subjects. But if you look at the pharmacodynamics, the urine output, I think we saw exactly the same urine output. So over the first couple hours, you see 2 liters of urine output, and over the next 24 hours, a total of 6 liters of urine output. So really what we found is really bioavailable equivalence between intranasal bumetanide and oral bumetanide in healthy subjects with a little the absorption of the intranasal product was a little bit faster than the oral, but
Hmm.
but overall, we saw very similar urine outputs and pharmacodynamic responses between IV, oral, and the intranasal delivery system. And you know what? The patients tolerated this well. There was some concern maybe they're going to have some nasal irritation. They wouldn't be able to tolerate this. Very well tolerated, a little nasal dryness. Patients, we had a nurse administer the medicine to the patients, but it's really designed for self-administration, just like any other intranasal product.
Now, let me ask you this, educate me. For regulatory purposes, is this good enough for FDA approval for bioequivalence, or do you have to do it in people with the disease, with heart failure?
Yeah, so for normal people who don't have exposure, can't take oral medicines or can't use their gut, this is sufficient. I'm no regulatory expert, but this is sufficient for regulatory approval, and it will be submitted soon to use this as an alternative to oral diuretics in people who are unable to take oral loop diuretics. Obviously, studies are now being started and are going to be ongoing soon, looking at how does this compare in a PK/PD world in patients who have congestion. And what we're expecting to see, like other things, we're seeing a much higher variability in absorption for the oral, and hopefully that in the nasal, we'll see a much more stable bioavailability in congested patients.
Educate me. Does your nose get does the membrane get congested in heart failure, or is that just a gut phenomenon?
Yeah, so you probably you have mostly it's the gut. You probably have a little mucosal swelling in the nose. All of these patients, it's very interesting. The HERO trial, we know, the HERO trial is looking at speech changes in patients with heart failure,
Right,
and we
right.
see vocal cord changes in people with heart failure where they become much more guttural when they come congested. So the oral pharyngeal membranes do get edematous. But we're hoping that the penetration, the capillaries and the mucosa is thin there, and we're hoping that the absorption and the bioavailability there is preserved. There's been some fascinating Japanese work correlating decreased oral availability of oral loop diuretics to colon wall thickness by ultrasound. So we know this is a real thing, and hopefully the nasal route will get around that.
Fascinating stuff, Dan. Well, thanks for sharing. Thanks for joining us, and thanks to all of you for joining us here live from AHA 2024.
Thanks, Michael. Thanks for having us.
Thanks. Thanks.